Hello, I'm Gavin and I work for Centra Europe. This is the latest in a series of videos that focus on the challenges of working with traumatic content during this time of COVID-19. The Centra is a network of journalists, filmmakers and psychologists who believe that the latest insights from trauma science can help journalists cover violence and tragedy more effectively and more safely. And the topic of this video is resilience and how editors and managers can support their teams. First things first, journalists are by and large highly resilient professionals skilled at covering tough emotional stories. But both professionalism and pre-existing experience don't by themselves make any one of us immune to the possibility that stories we're working on could affect our mental health. This is all the more so now with the prevalence of COVID-19. And so what kinds of risks are we talking about? Wherever media workers are directly caught up in a situation which involves death, injury, sexual violence, or the threat of any of those things, don't forget online harassment. That's something which can be particularly vicious towards women. Then there are the more indirect risks, such as vicarious or secondary trauma. This can occur whenever a journalist is working intensively with traumatic imagery or harrowing testimony. Think of it as the drip-drip effect of continually working with disturbing content. An added factor in this is the aggravating impact of something that's called moral injury. This is complex. That's what happens when people's basic beliefs in the world being just and fair are violated. That may explain why we're seeing an increase in mental health related issues among content moderators and fact checkers. Newsrooms at this time are trauma-facing organisations. Indeed, they always have been, but they haven't always been trauma-aware. A trauma-aware newsroom is one where everyone understands two key things about distress. The first is that experiencing distress isn't a sign of weakness. Rather, it's an inbuilt design feature of the human condition. As journalists, we need to be able to feel what's going on in order to connect with our sources and understand what's happening to them. The second is that distress by itself isn't in any way a sign that anybody is going to be psychologically injured by something. This idea that distress is somehow bad, shaming, and potentially automatically toxic leads people to kind of cover up things and cover up their reactions rather than exploring ways of managing them more effectively. Most people who are caught up in a traumatic event are likely to have altered reactions in the immediate aftermath. They may be a bit shaky, perhaps highly emotional, or even the reverse of that, and feel unusually numb. These reactions normally subside naturally. For people to maintain their resilience, what they need is adequate recovery time, everyday emotional support from their colleagues, and opportunities to work through any issues that come up. A newsroom culture that doesn't acknowledge this is likely to make its staff less resilient rather than more so. A trauma-aware newsroom tackles stigma head-on. It has a clear policy that no one will be punished for experiencing distress or needing support of any kind for a mental health-related issue. Be resolute on any signs of harassment, bullying or discrimination that you see in your organisation. It's doubly toxic when journalists are working with trauma. Psychological safety should also be part of your planning process. Factor it into risk assessments and staff rotations. Schedule recovery time for anybody working on trauma-heavy assignments. It's very important to know your staff, who their families are, who might need to be contacted if anything happens to them. Having those kinds of conversations are a sign that you care, and people always feel more resilient when they know they're valued. When a newsroom is working with trauma, it's a little bit like that invisible treadmill that exists under everyone's feet has started to speed up. And so as a manager, there'll be a whole bunch of things that you do normally to make your staff feel supported. The more traumatic the story and the higher the threat level outside increases, then the faster that treadmill is moving and the more you need to do. Here we're talking about quite simple things, making people feel that they're valued, consulting people, praising good work, being scrupulously fair, that kind of thing. When trauma's in the air, sensitivities become heightened. Often it's not the traumatic content of an assignment itself that leads to a flashpoint or a sudden crisis, but some other work-related pressure or stress around it. The following is a classic illustration of this. Imagine a journalist has been reporting from a COVID-19 affected hospital where lots of people have died, and they've been there for many days, doing great work, filing on time, and managing to keep themselves together emotionally. And then suddenly, out of the blue, they get an angry phone call from somebody in the accounts department querying their expenses. And then bang, this leads to an explosion, a feeling of acute betrayal, and is potentially even the beginning of a downward spiral. So here are a few things to look out for and to keep an eye on. Communicate clearly and often, and involve people in decisions which affect them as much as you can. In general, try and be scrupulously fair in how assignments are allocated, and always praise good work. It makes a huge difference. In this COVID world where people are hardly ever in the same room and not face to face, it's particularly easy for juniors to become paranoid about managers' intentions. As an editor, encourage people to do appropriate self-care, and moreover, model that yourself. Don't always be the last one to leave work, for example. Sometimes criticism is needed, but do be careful about its timing and how you deliver it. Where disagreements arise, to focus on the mission rather than the personalities involved. This has been a short video, and there's only so much detail that we can discuss here. The Art Centre has been working on these issues for more than 20 years now. And so please do check out our website for lots of resources on trauma awareness and education, and also on peer support. That's how an organisation can create a culture where staff know how to support each other and look out for warning signs. One last thought on this. Being in charge and being responsible for others can be a burden in itself. And so please do think about your own self-care as well. And also try and find whatever opportunities you can to talk through these issues with other leaders. The Art Centre website again can be found at www.dartcentre.org.